Meeting recorded.
Hello, everyone, and welcome to today's Understanding Medicare CEU Day 2 live virtual training. This is Melissa Moreno with the CMS National Training Program, or NTP, and I'm joined by my NTP colleagues who will be delivering your training and providing you with technical assistance. Claire, Carrie Watson, and David Santana will be your trainers today, and Mark Wernick, Joseph Warden, and I will be providing your technical assistance. We'll be covering Medicare Advantage Plans, Medicare and the health insurance marketplace, coordinated benefits, fighting fraud, waste, and abuse, and we'll have a presentation all about helpful resources. This is 2 of our 2-day CEU training. We offer these CEU training sessions once every quarter on a first-come, first-served basis. And though we're offering 2 days of CEU training, you're not required to attend both days, but you will get the most CEUs if you do. Yesterday, Day 1 offered you 0.2 CEUs for 2 hours of training. Today's webinar is a pilot. The exact number of CEUs that you can earn for today's training won't be determined until the conclusion of the course, but you can expect about approximately 2.5 hours of training today. Certain requirements that you'll need to complete to receive your CEU credits for each day that you attend training. Those include attending the live training, then you'll return to the NTP LMS to complete your attestation. That certifies that you attended the entire training. You'll complete the post-test and the course evaluation. You can complete these requirements by re-entering the CEU course for Day 2 in the LMS where you registered. Once you've completed all of the requirements, the link to access your certificate will be available within 3 to 5 days on the same page where you completed all of the requirements. Certificate will display the appropriate number of CEUs for each day you attend and complete all of the requirements. And as a reminder, once we've completed the training today, please don't drop off too fast because I'll be providing you with a reminder of all information again of completing your requirements for your CEUs, as well as posting some additional information and answering questions. You're also going to receive an email within just a few minutes that will automatically be sent to the email address that you registered with, and it will be a document that will also provide you with detailed step-by-step instructions on how to obtain your certificates and complete all of your requirements. We also want to provide you with some information to some of you who notified us that you need some particular information listed on your training certificates. So we've made changes to the certificate that you receive for training both yesterday and today. And specifically, we understand that some of you need to have information on your certificate indicating that the training was in live versus a non-live setting. So we've updated the course certificates with the word live located in the course name, and that'll better assist those of you who need that distinction. If you printed your certificate early yesterday and you need that live description on the title, you can go back into the course for day 1 and reprint your certificate. Lastly, if you don't need CEUs, we offer the information contained in this training in a learning module within our LMS, and it won't require you to complete all of the steps for CEUs. We'll also be posting a recording of this webinar in about 3 to 5 days, but no CEUs will be available for viewing the recording. If you know others who need CEU training, you can let them know that we'll offer this 2-day training again in April, and we'll be posting dates on our NTP website soon. Now, before we get started, I'd like to quickly go over a few technical issues with you. First, there are 2 parts to today's training. There's the conference call portion and a webinar portion. So please be sure that you join the webinar portion so that you can view all of the presentations and join in the activities that our speakers are going to be sharing with you. All phone lines have been muted so that everyone can have a good learning experience today. We're going to have a lot of interaction built into the sessions, including videos, so you'll need to be familiar with your computer and your phone volume features to ensure that you can hear those interactive items. Now let's go ahead and quickly look at some of the features in the webinar room. So if you'd like to ask a question, please type it into the Q&A box located on the bottom of the webinar screen. Many of the questions that you'll be asking will be answered during the course of the presentation, but if you do not get all of your questions answered, you can feel free to send them to our mailbox, which is training@cms.hhs.gov, and we'll share that again with you just a little later. Beside the Q&A box is our closed captioning pod, and to the left of that, you'll see 3 pods along the left-hand side of the screen. At the top, there's the chat box, and there are going to be some times that we'll be asking you questions, and we'll have you type your responses into the chat box. Materials for today's call are available in the pod that reads Files Day 1. So you'll see 3 items in that pod that you can download, including the documents is instructions, those step-by-step instructions on everything that you need to do to obtain your certificate and complete your requirements today. This National Training Program webinar provides basic information on the Medicare program, but you should always consult the relevant statutes, regulations, and rulings for official legal guidance. I also want to remind participants that this call is intended as an informational call for partners. It's not intended for press purposes, and it's not on the record. So if you're a member of the press, please go ahead and email our press office at press@cms.hhs.gov. Now we're going to have a couple of quick warm-up activities, and we're going to jump right in. All right, so for those of you who attended yesterday, you'll already recognize this, but for those of you who haven't, this is what we call a wuzzle. It's a word puzzle, and basically these are designed to help you reinforce concepts that you learn throughout the training. So we're going to have a couple of practices. Go ahead and type into the chat pod on the left-hand side what you think this is trying to represent. Okay. Everyone really fired today, and you've all got it right. This is Part D. This is the part of Medicare that provides prescription drug coverage. This one. Go ahead and enter your responses into the chat. Overwhelmingly, you're all saying Medigap, which is correct. This represents Medicare supplement insurance policies, or Medigap policies, which are private policies sold by insurance companies to individuals, cover your out-of-pocket that you're left with after Medicare pays your medical claims. Very good. All right, so let's have a quick review. Some of you are just joining us for the first time today. We want to make sure that you have a very quick, high-level understanding of the basics of what we covered. Essentially, we started at the very, very foundation of talking about the Medicare program. So what is Medicare? Essentially, Medicare is health insurance provided by the federal government for 3 groups of people. You have those who are 65 years of age and older, those who are under 65 with certain disabilities. As of any age, you have what's called end-stage renal disease, or ESRD. That's permanent kidney failure that requires a transplant or regular dialysis. You also need to understand that when it comes to enrollment, there are two basic entities that will handle those enrollments for people who are eligible. One is the Social Security Administration, and those who retire from the railroad, they're going to seek their enrollment into Medicare through the Railroad Retirement Board. After they're enrolled, everything to do with Medicare is administered by us here at the Centers for Medicare and Medicaid Services. We talked a lot about original Medicare, and there are some things that you need to understand when we're talking about original Medicare. Essentially, there are two parts. The first part is Part A. So we call this our hospital insurance because it covers all of your expenses if you're an inpatient in a hospital, as well as some home health care services and hospice. We also took a look at the things that are not covered through Part A, such as private duty nursing, a private room unless it's medically necessary, other things like television and phone services in your room, but sometimes those are included as part of your basic room charges, and personal care items like razors and slippers and socks. There's another part of original Medicare, and that's Part B. This is your medical insurance. So it's going to include most everything outside of your inpatient hospitalization care. This is medically necessary services like your doctor's visits and doctor's services, your outpatient medical surgical services and supplies, your lab tests, type of medical equipment, durable medical equipment that you might need, like a wheelchair or a walker and those types of things. It also covers your diabetic testing supplies and preventative services like screenings and flu shots, your yearly wellness visits, things of those sorts. Also, some home health services that are not covered through Part A can be covered under Part B. We also took a look at Part D. So Part D, as we said in our WUZL, is Medicare prescription drug coverage. And a lot of people who have original Medicare Part A and B will also enroll in a standard Part D standalone prescription drug plan. And this adds complete coverage essentially for them. But they can get this in a variety of ways. They can have that standalone plan that goes with their original Medicare. But if they choose to enroll in a Medicare Advantage plan, most times they're also going to have their prescription drug coverage pulled right into that bundle of services. Many other types of Medicare health plans, like cost plans, will often include as an option Part D coverage. Look at specific times when people have the opportunity to either enroll in Medicare or to make changes to how they get their Medicare coverage. So you can see there are quite a few here. The first is your initial enrollment period. This is the first opportunity you have to enroll in Medicare, and it centers for most people around their 65th month of their birthday, 3 months prior to that month and 3 months after, but it also can include for those folks who are under 65, their 25th month of disability, 3 months prior to that month and 3 months after. So after someone's IEP has passed, they also have an opportunity every year called the open enrollment period from October 15th to December 7th to changes in the way that they're receiving their coverage, and any changes they make will be effective January 1st of the following year. Now, we also have another period that comes around each year, and that's the general enrollment period. That's from January 1st through March 31st, and this allows people to enroll in Part B or Part A if they didn't during their initial enrollment period. Their coverage will be effective July 1st of that same year. We also have a new enrollment period. As you can see here, that's the Medicare Advantage open enrollment period, and it occurs at the same time as the GEP. So we don't want people to be confused. It is its own enrollment period. It's from January 1st through March 31st, and it allows people who had already enrolled in Medicare Advantage effective at the first of the year to any type of change to what kind of Medicare Advantage plan they want to be enrolled in. If they've decided that, for example, the Medicare Advantage plan they're enrolled in as of January 1st isn't the right plan for them, they have opportunity in the first 3 months of the year to change to a different Medicare Advantage plan, or they could opt to return to original Medicare A and B and enroll in a Part D plan. We also have, for folks who are in their initial enrollment period, a simultaneous Medicare Advantage open enrollment period 3 months after they enroll in Medicare. Now, the last two are our special enrollment periods. So, generically speaking, we have our special enrollment period, which can contain a lot of different reasons why someone might be able to make a coverage change, and they can use a special enrollment period at any time throughout the year if they meet the criteria. Usually that's around something we call a qualifying life event, a move out of your planned service area, maybe you lost Medicaid coverage or Medicaid Savings Program coverage, or maybe you gained extra help coverage. So different types of extenuating circumstances where Medicare recognizes that you need to make a coverage change. And lastly, we have our 5-star enrollment period, and this is very unique. It's reserved for our plans that have the highest quality rating that we can provide them with or designate them with, and that's 5 stars. They're the best of the best that we have to offer. And if you're fortunate enough to live in an area where you have one of these plans available to you, you can opt to enroll in their coverage one time throughout the year. And that can be either Medicare Advantage or health plan, or it can be a Part D plan. Also, the important reminder that enrolling on time is critical for people, and for a lot of good reasons. First of all, if you don't enroll on time when you have your first opportunity and you delay your enrollment, you could be looking at higher costs because you might have to pay what we call a late enrollment penalty. And for Part A of Original Medicare, it's not a lifetime penalty, but it is twice the amount of time that you could have been enrolled in Part A full calendar month, but you weren't. So, for example, if you waited 2 years to enroll in A, your late enrollment penalty for Part A would last 4 years. Now, when we talk about Part B and Part D, that's different. Those are lifetime penalties if you wait to enroll and you are designated to have to pay that late enrollment penalty. Consideration that your coverage would be affected if you don't enroll on time, meaning that you could have a gap in coverage. And if you have a gap in coverage, that's also going to impact your cost because you're paying for your health coverage on your own without any help from insurance. So you really want to avoid that. That could be very expensive. You ought to be denied buying a Medicare supplement insurance or Medigap policy if you wait, because you have what's called your Medigap open enrollment period that only comes around once when you have both Medicare Part A and B and you're 65. And if you don't use it when you have it, you don't have the luxury of guaranteed issue rights, and you have to pay more, you could be denied. So you heard me mention a lot about Original Medicare. That's because once you enroll in Medicare, you have a couple of different ways that you can think about getting your coverage. And for most people, by far, it's the most popular choice to use with Original Medicare, your red, white, and blue card that has Part A and Part B. But it's not the only way that you can get your coverage. And we're going to talk about that today. Kim's going to be sharing with you a lot of the details about Medicare Advantage, which is another way to get your Medicare coverage. Original Medicare, we have Part A, which is your hospital insurance, Part B, which is Medicare medical insurance. That's on your red, white, and blue card. And then a lot of people can choose to enroll in Part D prescription drug coverage, and they may choose to buy a private supplemental coverage policy called a Medigap policy to pick up their out-of-pocket costs after Medicare pays their claims. Now I'm going to turn it over to Kim, and she's going to talk about another coverage option.
Great. Thanks, Melissa. So we just went over Original Medicare, and now we're going to focus on the other side of that chart, the Medicare Advantage plan. So as another option for people get their Medicare benefits. And also said, by far, 9 million people use Medicare as a way to get their benefits, but the number for Medicare Advantage is growing, and for 2019 it's estimated to be about 22.6 million people for choosing this option of Medicare Advantage. So what is Medicare Advantage? It's an all-in-one alternative to Medicare, and they're going to be run by private insurance companies that have been approved by Medicare. They have to include the Part A and Part B services that we just went over in review today, so the hospital and outpatient medical services that are included in original Medicare Part A and Part B. Often plans also include your prescription drug coverage, or Part D, as we talked about yesterday as well. And because you don't have, because you choose Medicare Advantage, you're not going to need a Medicare supplement policy or Medigap. In fact, it's not even an option if you have Medicare Advantage. So you won't need to buy any separate supplemental coverage. Some plans may offer extra benefits or lower your out-of-pocket costs. So it's really important that you would evaluate each of the plans to see what their benefits they're going to cover. As we've talked about, they have to cover at least what's included in original Medicare Part A and Part B. But they could offer additional benefits, maybe like a gym membership, for example. Each plan is going to set their own rates and their own premium costs. We're going to get into that and what it costs in just a little bit. In general, there are 6 main types of Medicare Advantage plans, and it depends on your area whether or not all of these plans are available to you. This is a Medicare Health Maintenance Organization, or what's commonly called as the HMO. There's a network of doctors and providers within the plan's network, and you generally want to get care within the network. If you go outside the network, then you're going to pay the full cost. There's an HMO option that's called point of service plan, which essentially is the same thing, that there's a network, but you can go out of network for a point of service and it's at a higher cost. So as opposed to you paying the entire or the full cost under regular HMO, the point of service option allows you to go out of network with a higher cost associated with it. The other type is a preferred provider organization, which we're commonly referred to as PPOs. If you have preferred providers, which if you see those providers, then you're going to have the best available cost for you for out-of-pocket. However, you are allowed to see a non-preferred provider, but usually for a higher cost. There's a Medicare private fee-for-service plan, in which you can go to any Medicare-approved doctor or hospital that accepts the plan's payment terms and agrees to treat you. Also, special needs plans, and you'll see this abbreviated as SNP sometimes. And these special needs plans can limit the membership to people with specific diseases or characteristics. And they're going to tailor those benefits and provider choices and even their drug formularies to best meet the specific needs of that population. Also, Medicare savings account plans, and this really combines a high deductible health plan with a bank account. So Medicare deposits money in the account, and then you would use that money to pay for your health care services. Let's talk a little bit more about how Medicare Advantage plans work. As I just spoke of, a lot of those different options had a network or preferred providers involved in it. If you ever in need of emergency care, you can go out of network and it would still be covered. So you're always covered no matter which hospital or provider you're going to see if it's emergency or urgent care, meaning that you need the care urgently, your life depends on it. Also, talked about earlier, the plan has to cover your Part A and Part B services. So if it's included in original Medicare, the plan must at least cover those. For some MA plans, they can add additional benefits that original Medicare doesn't cover. For example, vision or hearing or dental. We talked about most Medicare Advantage plans are including prescription drug coverage, so it's not a separate option as Part D. It's part of that bundled service approach. You need to have Part A and Part B to even have the option to enroll in a Medicare Advantage plan. So you have to continue to pay your Part B premium And then your plan will also have a monthly premium. In some cases, the plan might set their premium at 0, or there are some plans that might offer to help contribute to your Part B premium cost. You in advance or have your provider ask in advance to make sure that a service is going to be covered, and this is called an organization determination. And you would just contact your plan for that specific information prior to receiving that service. The change and differ depending on the plan. So we are some things that go across all plans in regards to having to cover all of the A and B services, but they can charge different deductible amounts and premium amounts, and so as a result, you'll have different out-of-pocket costs, and you really have to compare when you're selecting the plan that might best suit your needs. Medicare Advantage plans can't charge more than original Medicare for certain protective services, and you can see the examples on the slide there is chemotherapy, dialysis, and skilled nursing facility care. Medicare Advantage plans do have a yearly limit on your out-of-pocket costs. It's a maximum limit, which this year is $6,700 for individual. And these are costs that go towards your medical services, so your Part A and Part B services. Now, plans can have different maximum out-of-pocket settings and depends on the plan, but it can be no more than that maximum that you see on the slide there. So the Medicare Advantage cost plan going to cost you. As we talked about, in order to join Medicare Advantage plan, you have to continue paying your Part B monthly premium, which in 2019 is $135.50. We hope that a couple of the plans could contribute that Part B premium cost, or they can set their own plan premium at a $0 amount. Just depends. Additional reminder for your Part B monthly premium is if you owe a late enrollment penalty for Part B and join a Medicare Advantage plan, that enrollment penalty does not go away. And the same thing for any prescription drug Part D penalty. Just because you join a Medicare Advantage plan does not mean that those late enrollment penalties will go away. The plan also set its premium rate, and that's the additional monthly premium to the plan. Some can set theirs at 0. The average for 2019 was released at $28 per month. Each is going to have a different structure in terms of the deductible, the amount that you have to pay before the plan starts to pay, your coinsurance and copayments. And different than original Medicare, it's going to vary from plan, and as we talked about, a lot of the Medicare Advantage plans have either preferred providers or network. And if you go out of those providers or that network, then you'll most likely be paying higher out-of-pocket costs. For those who have Medicaid or they have limited income and resources, they may qualify for additional help and cost savings to enroll in these plans. So in a Medicare Advantage plan. You have enrolled in the plan's area. You have to live in the geographic area that the plan is going to serve. So, for example, if you live in the state of Maryland, you could not enroll in a Medicare Advantage plan that serves the state of California. You have to be enrolled in Medicare Part A and Part B and be continuing to pay that premium. You have to be a U.S. citizen or lawfully present in the U.S. And you can't be incarcerated because, as we spoke about a little bit yesterday, if you're incarcerated, they could move you outside of the plan service area. You have to take an action to enroll. You have to contact the plan and follow the plan's rule, continue paying the premium, and the plan's going to ask you information such as your date of birth and your address, those types of things, your Medicare number, so that you can join the plan. And you would have to provide that necessary information to the plan so that you can enroll. And you can only be enrolled in one plan at a time. If you would try to enroll in another plan, it would cancel your enrollment in the prior plan. As Melissa, there are certain periods of time or life events for when you can change your Medicare coverage, and that's consistent with Medicare Advantage as well. So really your initial enrollment period, you can decide to join a Medicare Advantage plan. And you also have a few months period in which you can try a Medicare Advantage plan and then go back to original Medicare. So you can try it out for those 3 months. Then we're currently in. Beginning 2019, there's now a yearly Medicare Advantage open enrollment period, and this is available only to people who were enrolled in a Medicare Advantage plan as of January 1st. They have the next 3 months to switch to another Medicare Advantage plan, or they can return to original Medicare. They also can evaluate the choices in terms of drug coverage. So if they're going from a Medicare Advantage plan with drug coverage and they're returning to original Medicare, they can pick up a Medicare prescription drug plan if they make that change. But important note, if they're returning back to original Medicare, then they might not be able to get a Medigap policy. It depends on their state. There are additional enrollment periods that when somebody can decide to join or switch their Medicare Advantage plan. For those who were first eligible during their initial enrollment period and chose only to enroll in Part A and delay Part B for whatever reason, and then during their general enrollment period, so January through March, they add Part B to their Part A coverage. They'll have the additional time between April and June to decide whether or not that they want Medicare Advantage. Because once they have both Part A and Part B, that becomes an option to them. So that's a time period where people can enroll in a Medicare Advantage if you're picking up Part B for the first time during the general enrollment period. The next two bullets are really special enrollment periods that we talked about. Certain life events, for example, we said you had to live in the plan's geographic service area. If you were to move out of that service area, you would get a special enrollment period to switch in. Any change in your status of Medicaid or extra help, which is additional assistance for people with limited income and resources towards their drug costs, give you a special enrollment period in which to make a change to how you get your Medicare, and a change in your residence, like especially for an institution or long-term care facility. There is also the 5-star special enrollment period that Melissa had gone over during our review, and these are the quality star ratings that released each fall. And it's a reward for those our highest performing plans. So those that at highest rate, 5-star, somebody can use the opportunity to make a one-time switch. It's going to be starting in December 8th and run through the following year, because prior to this, it's the OEP, so you can use that to make any change. But if you wanted to use a 5-star special enrollment period to make a change to a 5-star plan, you do that between December 8th and November 30th of the following year. But how would you know which plan is 5-star, or how would you know which ones might be within your geographic area? And the tool to find that is really Plan Finder. This is on Medicare.gov, and I know David's going to be going through a lot of the Medicare.gov resources later on today. But specific for finding Medicare Advantage or prescription drug plans, this is an important tool to take a look at and be familiar with. So the screenshot's small there, but generally you have two options to search. You can do a broad basic search, but it also lets you put in specific information such as your zip code, your list of current medications, so that you can compare plans and see which ones are available in your area, see if your drug lists are on their formulary, and it allows you to compare the proposed cost and search for the Medicare Advantage plan that might be right for you. Certainly you would want to consider the type of prescriptions you take. Maybe you have a favorite pharmacy that you like to visit, because that can impact your out-of-pocket costs, whether you're using a preferred pharmacy to fulfill your prescriptions. The Plan Compare will also allow you to compare plans' monthly premiums, their yearly deductibles, any co-insurance or co-payments that you might have to do. If you travel a lot, you can see which plans might give you coverage in multiple states if you needed to. And that's also where you can find those ratings, those star ratings, to see which ones, if any, that you have 5-star plans within your area. Some people get the Medigap policies and the Medicare Advantage option confused. And you can see why when we do a comparison, because they are both run by private companies. They don't work with each other. In fact, if you have one, you can't have the other. So Medicare is filling in the gap in original Medicare. So you're going to have to be paying out of pocket for deductibles and coinsurance for your original Medicare services. And then Medigap policy is going to be scooping in and picking up those costs after Medicare pays. Whereas a Medicare Advantage plan is bundling all those Part A and Part B covered services, and they're adding any extras the plan might have, and most often include your prescription drug coverage. The government does provide oversight for both of them. So there's federal laws for Medigap, but then states have the rights to do additional protections for Medigap. Whereas Medicare Advantage plans, all the plans are approved at a federal level. You have to have Part A and Part B to get both of those. But if you are choosing original Medicare, then you're on that Medigap side. Whereas if you're choosing to do a Medicare Advantage plan, you can't have a Medigap policy. And for both options, you have to pay a monthly premium in addition to your Part B premium. It depends on the plan. So you'd have to do research and search using the plan finder or consult your state and your SHIP to review the Medigap premium. So from different options and how people can get Medicare to comparing really two different programs. We want to make sure that you identify that Medicare and the health insurance marketplace are really two separate programs, and they're not related in any way. Okay. In a person's situation, they can have an individual marketplace plan and then become eligible for Medicare. So there are certain times where people will experience a transition or an overlap of the two different programs. So the health insurance marketplace is for individuals to search for and purchase health insurance. They don't have it from another source. So if they're not eligible for Medicare or they don't have it through their employer. Individual marketplace plan, Medicare, you can't be sold an individual marketplace plan. That's even if you have Medicare Part A and B. The only exception is small businesses can also purchase health insurance for their employees through the marketplace, and we call this SHOP, the Small Business Health Options Program. And so if an individual has this insurance through their work, then it becomes similar to what we talked about yesterday. You have employer group coverage through active work. And therefore, if you are choosing to enroll in Medicare, you won't be subject to the late enrollment penalty to have that 8 months of SCP. Positions that employers can work through to get coverage for their employees used to be available for purchase on healthcare.gov previously, but for now, for 2019, you can still purchase them, just not through healthcare.gov. They would have to contact issuers and agents. So enrolled in an individual marketplace, and then you become eligible for Medicare. You can keep your marketplace coverage. There's no law that says you can't, but there might be some cost factors that you have to be aware of. Once you are enrolled in Medicare Part A and your coverage starts, that's considered minimally essential coverage. And as a result, you're no longer eligible for any of the tax benefits or cost savings that you might have been getting to help pay your marketplace plan. So then you'd have to be looking at paying the full cost of your marketplace plan. Also, if you have an individual marketplace plan and you decide to keep it and not enroll in Medicare, you could be facing late enrollment penalties if you do join Medicare at a later point in time. Because the marketplace plans, the qualified health plans, they're not guaranteed to have credible prescription drug coverage either. So you'd be looking at a Part B late enrollment penalty if you decide to join Medicare later, or a Part B late enrollment penalty if you decide to join Medicare after that. So Marketplace, you can choose to sign up for Medicare during your initial enrollment period, and then you'd ensure that you wouldn't be subject to those late enrollment penalties for as long as you have Medicare. For those who have a Marketplace plan through their SHOP coverage, as we talked about, they are entitled to that special enrollment period and wouldn't be subject to the late enrollment penalties. There's a limited time offer, which we call limited equitable relief, that's available until September 30th of this year. And that's people can be forgiven. The Part B late enrollment penalty won't apply for those people who have had Marketplace and then delayed their Medicare enrollment, and then as a result have a Part B late enrollment penalty. So there's a limited period of time which they can apply to have that late enrollment penalty removed. And now I'm going to turn it over to Carrie for a Check Your Knowledge on this.
Great. So let's see how much we learned about this last session. Maxine has individual Marketplace coverage. She's turning 65 and wants to wait and enroll in Medicare Part B when she's older because she and her husband have the same Marketplace coverage. She has worked long enough to get premium-free Part A. She doesn't have to worry about having a Part B late enrollment penalty. Her Marketplace plan will allow her to have a special enrollment period later. Is this true or false? Select which one you think it is. Okay, lots of answers coming in. I'll give another minute to those of you who are still deciding. Okay. All right. So it looks like most of you answered false. And as we just learned, that's correct. Okay. So So we have a couple more of those wuzzles that we started off with earlier. This one, I'd like you to take a look and see what you think this is. What does this represent? And you can use your chat box to put in your answer. Everyone's getting this one. Switch plans, plan change. But switching plans, and as we've discussed, there are certain periods throughout the year or circumstances when a person can switch plans, so it's really important that individuals pay attention to those time periods and make their choices during the time frames to avoid any late enrollment penalties of that or things like that. So, very good. Okay, this one's a little bit tough. Let's see if we stump anyone with this one. Wow, you guys are good. Very good. Network. So if you have, for instance, a Medicare Advantage plan, as Kim was just talking to us about, you will likely have a network of doctors or facilities that you will need to use to get your care, or else if you don't, you could have a higher cost or a higher out-of-pocket cost if you go to someone that's out of the network. Okay, with that, I will move on and I will be going through Lesson 3, which is Coordination of Benefits. And this is going to talk about lots of variables with regard to coordinating benefits that you may have, different insurances that a person may have. Basics. What is coordination of benefits? So if you have Medicare and other health coverage, each type of coverage is called payer. That's what we refer to it as. If there's more than one payer, coordination of benefits rules decide which payer pays first. So the primary payer pays what it owes on your bills first. up the limits of its coverage, and then your provider would submit the claim to the secondary payer if there are costs that that primary payer didn't cover. So in some cases, there may even be a third payer, depending on your situation. So Medicare can be a primary payer or a secondary payer, and it just depends, again, on the circumstances. And sometimes they may not pay at all if it's a service that's not a Medicare-covered service. The Benefits Coordination and Recovery Center, we call it the BCRC, helps with all of this coordination. Basically sign a coordination of benefits agreement with private insurance, other private insurance a person may have, retiree insurance, etc. So they can share insurance data and that they can then determine who is the correct primary payer for the claims. Also investigate when they learn that a person has other insurance. And then this is all so that they can figure out whether Medicare or the other insurance should pay primary or first. So they may make sure that Medicare gets repaid for any conditional payments that may be made. We're going to talk a little bit more about what that means in just a bit. A couple things I want to point out. There are some great resources available, and I know David will get into resources in a bit, but with particular attention to coordination of benefits, you can pull up on Medicare.gov a really great publication that we have called Medicare and Other Health Benefits, Your Guide of Who Pays First. And that really walks through many different scenarios of different kinds of insurance someone may have and gives a real in-depth view of who would pay first. Also, we have an entire training module, which is on coordination of benefits. It's module number 5, and that is located on the CMS National Training Program website. So again, that also goes into a bit more detail about coordination of benefits. When does Medicare pay? And this is a very simple visual of when Medicare can be primary payer, secondary, or sometimes other insurance plans should pay, and maybe Medicare shouldn't pay at all. Medicare pays primary if you have no other primary insurance. It's secondary if you have other insurance that must pay first. Medicare may make a secondary payment if it's appropriate. And then lastly, Medicare may not pay for services or items that other health insurance is responsible for paying. This will dig a little deeper into when Medicare is the primary payer. And for most people with Medicare, Medicare is the primary payer, which means Medicare would pay first on their health care claims. And these are some examples of when Medicare pays first. It is your only source of medical, hospital, or drug coverage. If your other source of coverage is one of the following, whether maybe you have a gap policy, as we talked about already, or some other privately purchased insurance policy that isn't related to employment that a person may have currently. And remember, Medigap pays those coverage amounts that are not covered by Medicare. Medicaid and Medicare coverage for those who may be like dually eligible, as we refer to it, and with no other coverage that could be primary to Medicare. Another example is retiree coverage, and that's in most cases. And to know how a particular plan works with Medicare, we really always encourage to check that plan's benefits booklet or to talk to the benefits administrator to go in depth to figure that out. Also, when your other coverage source is the Indian Health Service or Care for Life, and that program is for military retirees and their families. And lastly, COBRA. This, again, except during the 30-month coordination period for people who have ESRD. Next, moving along, when is Medicare the secondary payer? And there are certain types of insurance that must pay first, and Medicare would pay second. So I'll just talk a little bit briefly about each of these. No fault insurance is insurance that pays for healthcare services that are from things like personal injuries or damage to someone's property, regardless of who's at fault for causing it. And types might be automobile insurance, homeowners insurance, and commercial insurance plans. It usually doesn't pay for medical expenses that are covered by no-fault insurance. However, Medicare could pay for medical expenses if the claim is denied for reasons other than not being a proper claim. And Medicare could make a payment for those services if it's something that's covered under Medicare also. And also, if the no-fault insurance doesn't pay within 120 days, Medicare could make a conditional payment. And I mentioned this on the previous slide. The money that Medicare used for the conditional payment has to be repaid to Medicare after the no-fault insurance settlement is reached, or you resolve the claim. Medicare usually tries to recover that conditional payment from you or the individual, but the person is actually responsible for making sure that Medicare gets repaid, so that's important. Next, there's liability insurance. And this is the kind of coverage that protects you against claims based on negligence, inappropriate action, or inaction that results in an injury to someone or damage to the property. Examples are homeowners insurance, automobile liability insurance, product liability insurance, and the list goes on as you see on your screen. Medicare is the secondary payer in cases where the liability insurance is available. If healthcare professionals find that the services they gave a person can be paid by liability insurance, they may try to collect from that insurer before they even bill Medicare. That can take a long time. So again, just as we mentioned with the no-fault insurance, if the insurance company can't pay promptly, which is within usually that 120 days, the doctor or provider may bill Medicare. And again, the same thing happens. Medicare may make a conditional payment, and once it's settled, Medicare would want that payment. The next two are workers' compensation claims or federal black lung benefits. And those are benefits that provide monthly payments and medical benefits to coal miners who are disabled from black lung disease. So Medicare would pay second in cases. Now, what happens when you have a group health plan? Now, Medicare pays first for people with group health plans on certain circumstances, and they're outlined here. If you're 65 or older and have retiree coverage, if you're 65 or older and have group health plan coverage through current employment, and it could be the individual or their spouse, and the employer has less than 20 employees. And that's the key there, the number of employees that the employment has. Also, Medicare would pay first if a person's under 65 and has a disability and they're covered under a group health plan, but the employer has less than 100 employees. So again, that number of employees is an important key there. And lastly, if the individual is eligible for Medicare due to ESRD, and you have a group health plan coverage when that 30-month coordination period ends. You had Medicare primarily before you had ESRD.
Okay, great. Okay, we're going to take a quick break for some more of our wuzzles. Go ahead and type into the chat what you think this might be. And I see the answers rolling in. Like everybody's getting this one to be coordination of benefits. Exactly, as Carrie was just telling us about, these are the rules that determine who's going to pay first when you have more than one type of insurance. And sometimes there could be a primary payer, a secondary payer, and in some cases even third payers. All right, let's do another one. This one is. And Right, TRICARE, it's the active duty military personnel insurance. And certainly it plays into the coordination of benefits because TRICARE for Life, as Terry mentioned, can also be part of the insurance that's going to pay, but Medicare would pay first those who are retired from active duty. All right, Carrie, back to you.
Okay. So we're moving right along here. We are going to now begin our lesson 4, which is detecting and reporting fraud, waste, and abuse. And to help us better understand the topic, we're going to start with a video to go over some of the basics.
143 people across the country charged for milking the system for $712 million in false medical claims and bills, including 5 people here in the Bay Area.
Among 2 federal fraud conspiracy charges for his alleged role in a $20 million Medicare fraud scheme run by a healthcare company. Federal prosecutors say Dr. Henry Laura wrote home health care prescriptions for Medicare beneficiaries that were unnecessary or never even provided in exchange for kickbacks.
People at a North Texas hospice are charged with ripping off federal taxpayers for $60 million.
Today, the filing of charges against 3 individuals in connection with their scheme to fraudulently bill Medicare and Medicaid for more than $1 billion in medical claims.
And so today, the Department of Justice, in conjunction with the Department of Health and Human Services, is announcing the largest healthcare fraud takedown operation in American history. 412 defendants, including 56 doctors. These defendants have defrauded taxpayers of approximately $1.3 billion.
So, as we just saw, fraud can be quite a problem. So let's talk about what fraud is. So, causes of improper payments, including errors, waste, abuse, and fraud, are also sometimes known as mistakes, inefficiencies, bending the rules, or intentional deception. So, CMS's program integrity activities target all causes of improper payments, and we saw some of that in the video, from honest mistakes to intentional deception. So it's really trying to figure out, what's going on. Is it a, honest mistake, or is this on with the intention to deceive? Not all improper payments are fraud. Remember, fraud is intentional misuse of funds. Vast majority of improper payments are due to mistakes, unintentional errors that were made. And for example, an error may occur because a program doesn't have documentation to support someone's eligibility for a benefit, or an eligible person could get a payment that's too high or too low, and sometimes there's data entry mistakes and things like that we have to take a look at deeper to see what's going on. CMS is targeting all causes of improper payments to figure out what was talked about. They do lots of provider education and outreach to try to help avoid errors so that they can distinguish these cases that come out that are those mistakes that are made versus intentional deception. The most common error, though, is insufficient documentation. The Senior Medicare Patrol is a program that educates people with Medicare to take an active role in detecting and preventing healthcare fraud, waste, and abuse. This program not only protects people with Medicare, but it also helps preserve the Medicare program. Most of the work that's done is done through face-to-face contact, and that seems to be most effective. So the Medicare Patrol relies on volunteers. There's about 5,000 active volunteers throughout the year that work on this program. There's a program in every state, D.C., Guam, the U.S. Virgin Islands, Puerto Rico, so it's spread really far. You can contact a local Senior Medicare Patrol program to get counseling, find out what kind of events they may be having in your area, or even to volunteer. You web out, and I'll on your screen, but I would encourage you to do so, or give them a call, or even call 1-800-MEDICARE to get more information if you have any difficulty. In addition, the Senior Medicare Patrols work to address problems that people have with fraud. Any referrals to CMS, and their anti-fraud contractors, the Office of the Inspector General, the State Attorney General offices, local law enforcement, state health insurance assistance programs, state insurance divisions. Many types of agencies can be involved in fraud issues, and it really reaches a lot of agencies throughout the community and across the country. CMS also has Medicare Patrol liaisons in each of our CMS regional offices, and they serve really as a point of contact so that the Senior Medicare Patrols can, let us know about any kind of issues that may be going on and to share any kind of program information that may be helpful to us at CMS. So the best way to help us with the fraud issue is remembering the 4 R's. Okay, so a quick glimpse, and we're going to go into each one of these on the next few slides, but really the point here is that people with Medicare are really the first line of defense against fraud, waste, and abuse. And so we really want to get the message out there to individuals to know what these 4 R's are. And there's a great brochure available that's on your screen. The CMS product number is up there. You can go to Medicare.gov and search that out, download it, and it really is a great resource for everyone. So the first R is record. And we encourage people to record the dates of their doctor's appointments on a calendar, even making a note about what tests and services they got, save their receipts and statements from providers, and, encouraging seniors that may have difficulties, to ask for some assistance with that and keeping track. They can even contact that local Senior Medicare Patrol they have personal health journals that may be available to help them keep a record. The next R is review. So they have their information, they've collected it on their calendar, and now they're going to get they're going to get their Medicare summary notice. It's important that they compare what services they've gotten and what they to the Medicare summary notice to make sure that it's accurate, make sure that there's not something on there that didn't happen or that a service they didn't have. And it's one way that they can catch something that could be potentially fraudulent. Again, the Senior Medicare Patrol can help and assist individuals with this. And so they really, make sure that there's a continuous process that they keep this record, because it would be really ongoing that they would need to manage and make sure they're always checking and being aware. If they're in a Medicare Advantage plan, they would want to maybe call their own, call their Medicare Advantage plan for more information. But if they have original Medicare, they can call 1-800-MEDICARE and get some assistance or ask a question if they suspect something's wrong. The third R is report. And we want people, if they do, like we said, if they notice something, they can report it. And I already mentioned that they could call 1-800-MEDICARE. There's an automated phone system that they could use, and they would want to make sure that they had their Medicare card and number with them so they could enter the information into that automated system. And also report fraud to the Office of the Inspector General. And contact information is on your screen. There's a website or a telephone number. And they can also contact that Senior Medicare Patrol, as we talked about on each of these slides. Really a great resource. And remember, so protect your Medicare number, and remember to do that. Don't give it out except to people that need it, like your doctor, healthcare provider, or someone that works with Medicare at CMS, perhaps. Never give your Medicare number in exchange for any kind of special offer, because, you know, typically CMS doesn't participate in those kinds of things. Never let someone use your Medicare card, and never use somebody else's Medicare card. These all sound pretty simple, but these are ways that we found that, you know, the number may get out there and, you know, people may use it for the wrong reasons. Know that Medicare won't call you unexpectedly to try to sell you anything, so don't give the number out on the phone. Okay, so those are the 4 R's, and again, they are record, review, report, and remember. So with that, we have another video. And pull that up.
I've already got 8 Medicare numbers, and I'm going for number 9. Prescription drug cards look just like the real thing.
Well, Medicare would really pay for a housekeeper. Some people will eat anything.
Okay. That just, again, reemphasizes, you know, some of the things that may be going on out there that we, you know, must be aware of with regard to Medicare fraud, waste, and abuse. And so with that, we come to the end of Module 1. And we have a review for you that's going to on everything that we've learned so far. And we are going to ask you some questions and ask you to chat your answers into the chat box. The first question, Medicare program has how many parts? Okay, lots of 4s. Correct. We have let me ask you, what are the 4 parts? Now you've identified there are 4. Great. Lots of correct answers, A, B, C, and D. And remember that Part C is actually that bundled Medicare Advantage, which Kim gave us a great presentation on today. Question. Medicare offers coverage options that allow couples to enroll in a family plan. Or false? False is coming in strong in the chat box. And that's right, Medicare is a plan that individuals would get. So if there's a husband and wife, they would each have their own Medicare enrollment. Okay, you're doing so good at this. We have one more. True or false, only people with Medicare can help fraud, waste, or abuse? Lots of, and can you tell me what's one organization or person or agency that could help fraud, waste, or abuse besides the people with Medicare? Great. G, Office of Inspector General. I see SMP, which is the Senior Medicare Patrol. Not forget 1-800-Medicare. There. Okay, so great job. You made it through Module 1. Before we begin our Module number 8, which is the Resources module that is going to walk you through quite a bit of helpful resources, we are going to take just so that everyone can stretch, maybe grab something to drink. So we will come back and begin that Module 8 in about 3 minutes or so. So enjoy.
Welcome back. We will now begin Module 8, 2018 CMS Program Resources. It's my pleasure to introduce my colleague, David Santana.
Mark, and hello and welcome everyone. Thanks again for joining us today. And my goal in here with this presentation is to walk you through some websites and resources that exist to help you find more information about those topics that we just went over past day and today. I thought also that it was appropriate and timely the passage of the 21st Century Integrated Digital Experience Act, or IDEA Act, was passed last month in December to ensure that all government websites are user-friendly. So again, was designed to make all government websites easily accessible and easy to understand to the typical individual. I hope that giving you some websites and highlights to help you get more information and resources about what you have learned today and more. Information about the slide presentation. Main objective of today's presentation is to help you identify websites that will guide you to find information about CMS program and related resources, as well as Social Security websites or government websites and resources to help you find information to help individuals make an informed choice. So the websites that I mentioned that we're going to highlight today is, of course, CMS.gov website, with the official CMS website for our partners and professionals, Medicare.gov website, Medicaid.gov, Now.gov website, Health.gov marketplace, and as I mentioned, talk a little bit about Social Security websites. All right. Apologies, these slides were moving quickly there, and so again, we're gonna highlight some of the information on those websites that you to get more resources. I'm gonna start by highlighting the CMS website, and as I mentioned, this is the official website for CMS. It contains the content on the website is used primarily, as I mentioned, for partners, providing individuals who do research related to CMS programs. So information that you can find in our website, the thing on the page is highlighted there. It's newsroom. This is will contain press releases and information about how to contact our press office. I see on the top of the page, and there highlights are in yellow, those tabs in there to get more in-depth information, for example, about Medicare, Medicaid, Medicaid coordination of benefits with Medicare, private health insurance, Innovation Center, regulations and guidance, research and statistics, and outreach and education. We go over each and every tab briefly to show you what is under each tab. Medicare tab. You and all the information that you heard between yesterday and today, and how to get more specific about those topics. As you can see in there, when you go under the Medicare tab, you will find information, for example, general information about Medicare, the Medicare card, beneficiary notices, basically information that we send to individuals in Medicare, and much more. again, on new Medicare card, you can see in there that give you some more information about the new Medicare card resources, how we're mailing the cards, what the card looks like, and so forth. We have been talking about eligibility and enrollment also for the past 2 days during this training. And to get more specific information about eligibility and enrollment under Medicare Part A and B, Medicare Advantage, prescription drugs, eligibility for low-income subsidy, as well as Medicare and the marketplace, you can just go to this tab over here on eligibility and enrollment, and you will find a wealth of information about those topics. Now you will also find the Medicare coverage database. You can see in there on the top 5 resources. The first is the manual instructions, and we'll go over the manual instructions in a little bit. Over here is highlighting the Medicare coverage database. In here, you will go to find information about Medicare covered. There is a lot of information in there about Medicare national determinations, national coverage analysis, low coverage determination, articles, and more information about coverage determinations and decisions that CMS make and is published on this tab in here. Now, Medicaid and CHIP tab in here provide much more information, more detailed information about Medicaid and the Children's Health Insurance System program. And again, this is where you will go to get more specific information about Medicaid and CHIP eligibility. Now, under the Medicare and Medicaid coordination tab, you will see information about how Medicare coordinates benefits with Medicaid. You click the Medicare-Medicaid coordination link. There is a list link that you can join for updates. The Circle Medicare-Medicaid Coordinating Office hyperlink at the bottom of the page to join the listserv as well. The Health Insurance tab takes you to the Centers for Consumer Information and Insurance Oversight homepage. Here you can find information about the marketplace and resources that you can use to find much more information, detailed technical information about the health insurance marketplace and how to help consumers with their questions and enrolling. Policy clarifications are displayed under this tab as well. Now, Centers for Medicare and Medicaid Innovation, or also called the Innovation Center, support the development and testing of innovative healthcare payments and services delivery models. You can select this tab to find out about innovation and your specific state, as well as updates about what's happening with those which model or different type of innovation testing that are going on locally in your state. You can see that there is an interactive map in there that you can click to information about what model is being tested in your state and eligibility criteria and more information under that tab regarding innovation. Let's see, it seems like my computer froze. Mark or Melissa, if you can click on the slide to see if it's advanced, because mine froze and it's not a thing. Thank you.
We are on, you could try refreshing your page and slide are on.
We are under the next slide, I believe, is the CMS manual. I think it's the one.
CMS manuals, okay.
I mentioned about the CMS manual. This is where we go, and this is where our administrative contractors go, and other entities that work with CMS for instructions about specific issues or topics that you're looking for, such as when you call and you ask information about how Medicare process claim, for example, for dual medical equipment, kidney transplants, different type of services, Medicare covered a service not, this is where we will go for information. And information, again, is available to you. This is where we go to answer your questions. So if you could just come here to find the information, and of course, if you're not able to get the information you're looking for, you can always reach out to us, and we'll research and trying to find where the specific guidance instructions are. CMS have 25 internet-only manuals covering a variety of topics. And again, when you look back to what you learned in the past couple of days, we'll be looking for information about Medicare eligibility, Medicare benefits, what Medicare pays for and what Medicare doesn't pay for. We just talked about coordination of benefits. There is a manual in there about coordination of benefits and everything that there is to know about how the policy works, the instructions that we get and that we gave to our Medicare administrative contractors about how to process claim, under what circumstances, specific laws and regulations apply to a specific topic. So these manual instructions are basically derived from the regulations, which are derived from the law. So this is a specific direct link between the manual instruction and the respective regulations that those instructions are derived from. So again, this is where you can, you put on the previous page that this is the popular resource that everyone go to get information about all topics in Medicare. You see that each manual is broken into chapter according to a specific type. For example, in here we highlight inpatient hospital service cover under Part 8, and you can see that if you look down, direction of coverage for inpatient services, psychiatric service, lifetime reserve dates, and everything there is to know about how we process hospital claims. Now, so the research and statistics and data tab in here, and this is basically for you to use to data and information on products and CMS program. And again, this is a consumer-friendly site in here to get more information about our programs and statistics that you can use to, for example, how many people are enrolled in the program, how are we paying for services, and much more data in there that is very useful to individuals. Under outreach and education tab is where you will find us. You will see there that is when you click in outreach and education tab, you will see in there getting training. Now, click on getting training in there. You'll find three in there. The first is a Medicare Learning Network training, Medicare Access and Chip Reauthorization Quality Payment Program, the CMS National program, which is our training program. So this is where you find us on the website. Now, we have migrated our training material and resources to a new learning management system platform that enables you take courses, download documents, watch videos, and access for helpful tools in our website. You can search products by the name of the Cadillac. You can see here that we have a self-paced online training. We also offer webinars, face-to-face in the training workshops. You can also watch a video in there that will guide you to, on how to use our website. Resources are organized, as you can see here, by 3 topics in our training materials, tools, and videos. And then we invite you and encourage you to visit our website and browse our resources in there. Of course, if you decide you can create an account, you can also sign up. If you enroll in a course, the system will prompt you to create an account under My Training tab. This way, your scheduled courses, the CEU and other course completion certificates will be saved in a system for you to access at any time. Now, the product ordering CMS at HHS site, this is for individuals to order CMS publication. Again, this is a very popular tool that individuals use to order publications on CMS. And you just basically type in your browser, ordering CMS at HHS.gov website. If you don't have an account, you can create an account and then you can order publications in bulk.
Thanks so much, David. We're going to pause here for a quick knowledge check to see if everybody was keeping track of the great resources you were going over. So, Health Policy student is working on a research paper and is looking for some data about the Medicare program. Which site would you recommend? Medicare.gov, B, InsureKidsNow.gov, C, CMS.gov, D, Wikipedia. And you can just, I see some people are chatting them in. You can also click on the answers in the poll option. And give a little bit more time. I see people are still answering. Looks like the majority of folks have this right, and it's going to be C, CMS.gov. The information on CMS.gov is geared towards our partners. So it has the data navigator that David went over, which is especially helpful for people that are seeking data for on the programs that CMS manages. And back to you.
Thank you, Kim. I see I can, my system froze and
we can help advance it for you. We're on Medicare.gov slide.
All right, so you can just go ahead. I'm going to reload in here to see if I can regain access.
Okay.
So the Medicare.gov website, of course, is the primary source of information for people with Medicare and as well as caregivers. Again, this is a consumer-friendly website geared for people in Medicare to gain information, to find more information about how Medicare works. You can move to the next slide, Melissa. So This is a shot of the Medicare.gov website. As you can see, there's a tab in there that talks about signing up for Medicare, your cost of Medicare, what Medicare covers, and much more information in that home page. These slides are just basically highlighting I'm not sure here which one slide is 31, right, Melissa?
Find a doctor, provider, and supplier.
All right. So when you scroll down on the homepage website, you can see that you have many tabs in there that find, compare doctors. This is where, for example, when you are looking for hospital, nursing home, comparing, finding doctors, is a very helpful tool here. You can go to get more information about which doctors are in Medicare, which doctor do not participate in Medicare, which doctor, for example, do not accept assignment, and so forth. There, of course, the Medicare find the tab in here. This is where you would go to find and compare Medicare Advantage plans as well as prescription plan. This is where individuals use throughout the year to find which plans are operating in their area and compare those plans with the original Medicare, and even enroll online when they find the plan that are coming with their needs and budget. On the forms, help, and resources, you can see that you can find the free Medicare publications, mail you get from Medicare. So free Medicare publication, when you click them here, it'll take you to the publication website, and you can search for basically any topic on Medicare. And if you want to find out that Medicare sent to individuals every year and what they look like, you can click that tab, and you can see that these slides kind of highlight, for example, if for the income monthly adjustment amount determination notices, what it is, who gets, and what information you get from those notices, and many more that Medicare sent to individuals. This is where you go to find out what does it look like and what it says and what it's for. And I mentioned when you wanted to find more information about the program, you can look for publications. There's also there is publication for almost all the topics that we covered yesterday and today. So we encourage you to go here too and search for publication. This is where the Medicare and You Handbook is. This is where information about Medigap policies. We have an entire publication about Medicare and Medigap, prescription drugs, Medicare Advantage, and so forth. So the information in the publication is break down a bit further to help you better understand those topics. On the helpful contacts and resources, if you go to this tab in here, you can just basically go down to your state and look for information in there. For example, if you want to find your Medicaid agency in there, the SHIP program, if you want to find some information, who to contact in your specific state about, for example, getting counseling for Medicare, one-on-one counseling, there's information in there. So if you're looking for local resources, this is where you would go down to a specific state to find helpful websites and information about who to contact for more information on a specific topic. MyMedicare.gov under the link right in the right side on the screen. This will allow individuals to sign up and get 24/7 access to their Medicare record. When they go to the doctor and receive service, they will be able to see their claims right away here. They also have the option to sign up to receive electronic Medicare summary services and also electronic Medicare and You Handbook. So we do encourage individuals to sign up for MyMedicare.gov so they can have access to their information. There's also information in there about preventive services and much more. So there's information available in other languages. You can do, and hereby, on the top left corner of the screen, under the home page, you will see in there Espanol or Spanish, and also for more languages, information in different languages. You can go to CMS and information in other language to see what other languages we have available in there for individuals to get information in that specific language. I mentioned before, the Medicaid.gov website provides much more specific information about the Medicaid program, eligibility, enrollment, and specific information about the state Medicaid program for the individual in their specific state. Now, the health insurance program, also there is a wealth of information in there about the children's health insurance program in terms of eligibility, enrollment, and assistance. The kidsnow.gov also is a website administered by CMS that provides information about the SHIP program, eligibility, and how to enroll in the SHIP program.
Great. David, we're going to pause now again for another knowledge check. And this is going to be one that you don't have to chat your answer in. You can go ahead and select the radial button with your vote. Your grandmother just called you about a letter she received in the mail. Says it's from Medicare and wants you to help her with it. Which website might you go to see samples of mail that Medicare sends? Medicare.gov, B, InsureKidsNow.gov, C, CMS.gov, D, Wikipedia. Answers coming in. And most of you are getting this one right. It's going to be Medicare.gov. In this instance, you're acting on behalf of your grandmother, so in a caregiver role, and Medicare.gov is intended for people with Medicare or their caregivers. And pointed out, it has a section that will show samples of mail that Medicare sends.
That takes us to the next website that we wanted to highlight to you today, and that is the Medicare.gov website. And this is the official government website for Health Insurance Marketplace. It helps individuals find health insurance that best suit their needs and budget, whether it's a private health insurance for individual, families, as well as a small business. Again, this is the website for consumers to go and find and compare and enroll in private health insurance plan, and also for a small business to search and purchase health insurance for their employees. Marketplace.cms.gov is the official website resources for assisters, navigators, certified application counselors, and other partners to help with insurance marketplace consumer questions. So again, there is a wealth of information on this website for individuals who help consumers, their training, their resources, and there is a wealth of information there to help them, help others that depend on them to make an informed decision. Also, that we wanted to highlight the Social Security website, as is a house of information for individuals seeking Social Security related resources, as well as Medicare resources. As you know, Social Security is in charge of enrolling people in Medicare, and therefore, to enroll in Medicare, individuals could go here, and if they meet certain requirements, they could go ahead and enroll for Medicare. The quickest way to get to Medicare resources on the Social Security website is by clicking on the menu button on the top of the page and select Medicare in there. Once you select Medicare on that menu button, it will take you to more information about Medicare program, including but not limited to how to apply for Medicare online. And again, you can check them here to see who's eligible to apply for Medicare online. Not everyone can submit an application online. There is specific resources and information about who can use this tool. Those individuals that could use the tool, is rather easy to go ahead and submit an application for Medicare. It only takes about 10 minutes if they meet the requirement to read the application online. And there is much more information and publications on their Social Security website relating to Medicare. If you scroll down to the Social Security website on the bottom of the page, you will see that there are more menu buttons in there. For example, if you click on publications, it takes you to the publication website under Social Security. You can click in here on the search button for any topic that you are looking for information under Social Security. So if you type in Medicare, it'll pull up all the publications that are related to Medicare enrollment, Social Security disability benefits, SSI benefits, and so forth. They have a wealth of publications in here that you can use. One highlight that we do have in here, but I wanted to mention to you, is the source of information for many professionals to provide, including the Social Security guidance. Those are called program operations manuals. You type on the search box and here on the top of the page and type program operations manuals, and it takes you to that website where Social Security have all the information related to the program. Very similar to our program operating manuals I mentioned before, or the instructions that I mentioned before for CMS. The Security has the same thing on their website. Those manuals are written by CMS, anything that's related to Medicare eligibility and enrollment. So if you pull the program operations manual and go, when you view the table of contents, you go down and click on health insurance, and it takes you to all related information about Medicare eligibility and enrollment step by step, and how, for example, when you call Social Security or go to a local Social Security office, it will tell you exactly how your claim should be handled, who is eligible for Medicare, who is not, what is the process to sign up for Medicare, and again, much more detailed information that we're giving you on our training modules and what you can find on the general Medicare website. So again, it's more specific information there that you can find on those manual instructions. Regulations.gov, as I mentioned, this is where you go to find out anything related to regulations that is being worked on. If you wanted to go and comment on a specific rulemaking, this is where you would go to find that regulation and submit your comments. You can search in there for the topics that you're looking for. Do a gun search, and then pull up that regulation and see. It'll give you instruction there about how to submit comments if you have a comment on that specific topic that they're considering to develop regulations on. There is an advanced search in there on the website that if you have more information about that specific regulation, you can just go to advanced search and do the search in there. Search a range and when the regulations was released, and pull the information from there. So again, we just wanted to give highlight this website as a resource to go to find out what's going on with regards to new topics and regulations that we're working on. Importantly, the Electronic Code of Federal Regulations is where everything is housed with regards to all federal regulations, government-wide, are here. We mentioned about our manual instructions before and where those manual instructions derive from. Those manual instructions derive from these regulations, which are part of the law. How do you access Medicare information from the Electronic Code of Federal Regulations? Our information with regards to Medicare is Title 42. So when you click on that drop-down menu, you click Title 42, and that'll take you to where our regulations are housed. You can see that there is a range in here from 400 to 700 is the Centers for Medicare and Medicaid Services. Once you click on this range, it'll take you to the next screen, which is the chapters of those regulations. And here you will find pretty much everything that we talked about. Eligibility, election, enrollment, Medicare Part A, Medicare Part B, C, and D. If you want to find more information about or information related to Medicare Advantage, you can see in here on the right side that, Part 42, when you click in it, it will tell you everything, all the regulations that have been developed with regards to Medicare Advantage plans. More specific language is also on the manual instruction that we mentioned under CMS, but again, this is where those manual instructions derive from. This is where you will go and find the official language with regards to a specific topic. And to highlight that we also comply with the Section 504 and 508 of the Rehabilitation Act. We required CMS and all federal agencies to make sure that individuals with disability have access to information, resources, to make sure that they take advantage of the programs that are available to everyone. In regards to CMS, we do have a group of individuals in there, the Customer Accessibility Resource Staff, or CARS, that is there to assist individuals to gain access to formats such as large print, braille, audio, and so forth, and provide guidance and support on developing communication plans, start operating procedures to incorporate the provision of deliveries of the aids and to organizations, practices, and so forth. We do write in here the how to access these group of individuals, Medicare publications. There's a toll-free number in there, then address, and much more information about how to access this group for more assistance. Ways to stay connected. Most websites provide a link to sign up to get updates, as I mentioned. Also have a YouTube channel in there. That's a site in to access our YouTube channel. Twitter, Facebook. CS also has a marketplace present on Facebook, Twitter, and that's to the puzzle.
Great. Thank you so much, Dave, for all those great resources. And I can see that you're used to this exercise by now because you're already typing in the correct answer. We have a couple more picture puzzles or wuzzles. So go ahead and type in your answer in the chat box if you haven't done so already. And I'm seeing the answer come in website, correct. David went over numerous different websites that it can be very helpful in finding information about Medicare. Next one. Go ahead to type your response to this wuzzle into the chat. We're in the midst of it right now, right? Our online training, and CMS National Training Program does offer numerous online trainings throughout the year. We are recording this webinar, so we'll plan to post that. We also will offer our CEU webinars quarterly, and we'll post more information on our website that David has already gone over today, but you've also already accessed in order to register and get here today. Next one. There it comes. I'm also still typing, and here it comes, the answer. Correct. We explored different resources such as extra help, and the low-income subsidy is also referred to, that will provide additional additional resources to those that have limited income and resources to help them pay with their drug costs. This one is a little bit more complex than some of the others. Still on top of it. Correct. The Medicare and You handbook that is mailed out to each household with Medicare every fall so that they can go over current information as well as regionally specific information within their area. It's also available online, as David showed, so it's a great resource to have a PDF version of it, maybe saved to your desktop for quick and easy information. Comes our next one. Couple of plan search, but the actual tool we refer to it is Plan Finder. Correct. And this is available on the Medicare.gov site, and it's available for people to do a general search about Medicare Advantage or Medicare prescription drug options within their zip codes. And it also has the ability to put a personalized search in which they can enter their Medicare numbers and their list of drugs to see which plan might have the lowest out-of-pocket costs for them and which plans might have their current drugs on their formularies. Right, so a good tool for comparing your Medicare options there for drug coverage. And on to our last wuzzle of the day. Hopefully in this training, you can help others with this and have peace of mind when they're navigating through their options with Medicare. It's a great job on all the wuzzles. We really appreciate your continued participation in those and chatting in your responses and feedback to that. Now I'm going to turn it over to Melissa for some closing notes.
Fantastic. Thank you so much, Kim, and thank you, David. So we've had a lot of information that we've covered today, and for those of you who were also with us yesterday, it's been quite a journey, but we hope that you have learned what you seek to learn, or you had a refresher on what you needed to refresh. And to that end, I'm going to ask you a question, and I'd like you to type your responses into the chat box, please. Go ahead and tell me name one thing that you've learned about the Medicare program or resources that you didn't know before you took this course. Okay, I'm seeing a lot of resources and rules, information about Medicare Advantage. Okay, you're bringing in a lot of things that you've learned. Fantastic. That tells us that you gained some helpful information. So now go ahead and type into the chat, what part of the course did you find most helpful? What section of learning did you find most interesting and helpful for what you needed? Oh, okay. A wide variety. From wuzzles to Mod 1 to resources, the overview. Oh, you like the interaction. I'm so glad. Naomi says the wuzzles are cool. Well, we're glad that you like them. That's awesome. So, what we're going to share with you now, of course, our module has a list of acronyms. We have our information here about how you can contact us. So I think we have some more time available. If you'd like to ask some questions for David, our speakers today, you can go ahead and type those into our chat Q&A box, and we will try to answer some of your questions live. So any questions or something specific to the content of today's training? Okay, so we do have a question asking about dental coverage. So the answer is that Medicare does not cover dental benefits for folks like cleanings and so forth, and fillings and all the things you think as routine dental. But there are some additional supplemental benefits, allowances that you might be able to find offered through Medicare Advantage plans. So that is one edge, if you will, to the Advantage plans that some people find very helpful. So original Medicare won't cover dental, but you may be able to find supplemental through Medicare Advantage. Let's see if I have another question. Question about Medicare Advantage, and I'll give this one to you, Kim. How exactly Medicare Advantage work with Medicare?
Okay, so Medicare Advantage is actually a way to get your Medicare. So it is a bundled services of the Part A and Part B services. Most Medicare Advantage plans will include prescription drug coverage, as we talked about, but there's not really a coordination between a Medicare Advantage and original Medicare per se, because it's the other option. Unlike Medigap, which would be filling in the cost, the out-of-pocket costs for those who choose the original Medicare option. So if you recall, there was the slide that really had the two different branches. So you would have original Medicare as one way that people can get Medicare, and that would include the option of a Medigap policy to help with those out-of-pocket costs if you have Medicare Part A and Part B. And the other side of that chart was the Medicare Advantage option. So you're going to be going with a private plan that's been approved and reviewed by Medicare, and it's going to bundle those benefits for you. So you're going to get all of your Part A and Part B benefits. Most will also include your drug benefits, and as Melissa had mentioned earlier, some can add extra benefits like dental coverage, and you'll just be paying that private plan premium along with your Part B premium.
Okay, this one is really a clarifying question. Did I understand that Medigap always pays first? The answer to that is no. Actually, Medigap payment follows payment after original Medicare, so they kind of mirror each other in that way. Original Medicare will pay first, appropriately for medically necessary claims, and then the Medigap policy would follow to pick up out-of-pocket costs appropriate to the specific plan type that you purchased. And let's see, what else do we have? I think I saw a question. Someone asked if someone is enrolled in a Medicare Advantage plan, do they need Part D? Can you do that one, Kim?
So most Medicare Advantage plans will have prescription drug coverage included as part of the bundled pieces of service. So generally there are standalone prescription drug plans, or what we call Part D. That's an option for people to choose if they have original Medicare. So Part A and Part B, if they want drug coverage, then they would elect a prescription drug plan, a standalone, which is sometimes called a PDP plan, as for their drug coverage. For Medicare Advantage, most often they will include the prescription drug coverage as part of that bundled service. So a Medicare Advantage plan most often does have prescription drug coverage.
And I have a couple of Medigap questions for you, David.
Okay.
All right. So the first one is from someone who is a care coordinator coordinator. I want to know, is there a way to find out if a patient has a Medigap supplemental policy?
To find out if they have a Medigap, if the individual has a Medigap, they should have a card in that they have a Medigap plan. They could also contact Medicare. I'm not sure if the individual have access to the disability query, if it's a health professional. But they can find out by just calling one Medicare and asking what type of coverage that individual have. So Medicare, regional care, Medigap, and even they have like a private plan through an employer that is paying primary or secondary to Medicare. We have that information as well. Also, if they don't have a card, you could call 1-800-MEDICARE if you're a health professional that access to eligibility query. You're able to get that information too.
Thank you so much. I have another question for you. Someone asked, why can't a client have both an Advantage plan and a Medigap policy?
Policy, as Kim explained, were created by Congress to allow people in Medicare who don't have any other supplemental coverage to have a plan that will supplement Medicare. Because Medicare is not an all-inclusive program. It doesn't provide catastrophic protection. So ideally, you will need a supplemental plan to have a rounded coverage. When you have a Medicare Advantage plan, however, you have other services that are not typically the original Medicare, such as the first is that they have a catastrophic protection. When individual spend in average $3,400 to $6,700 out of pocket, the plan comes in and pay 100% of the cost for the rest of the year. So there's really no need to supplement the Medicare Advantage plan because the plan itself is bundle coverage. And the out-of-pocket protection that you have on the Medicare Advantage plan, just we supplement that plan, doesn't really add much value to the individual coverage.
Okay. We have another question. Okay. We have someone asking, if someone wants to switch their Medicare Advantage plan enrollment, can they do so during the open enrollment and the Medicare Advantage open enrollment, or only during the Medicare Advantage open enrollment? Can I answer that for us?
Great question, Rebecca. And the answer is they can do both. Open enrollment is for making changes. So you can make changes between different Medicare Advantage plans, but also back to original Medicare. The caveat for the Medicare Advantage open enrollment period that is new this year and started in January and is going to end in March is that you have to have already been in a Medicare Advantage plan as of January 1st, eligible to use this time period to switch and make that change. So it limits the number of people that could use this period because you already have to be enrolled, where the open enrollment period is for anybody to make changes to their Medicare and really compare plans. And there are also those special enrollment periods that we talked about that depend on a life qualifying event, like if you move outside the plan's network, and then there's the 5-star plan rating that you are able to use once per year.
Okay, thank you. David, I have another Medigap question for you. Is there an age limit for going to get a Medigap policy, meaning that once you're a certain age, it's no longer an option?
No age limit to buy a Medigap policy. However, the longer you wait, the higher the price you would pay for the policy at a later time. I mean that you are outside of the Medigap open enrollment. Of course, there may be individuals that wait to sign up for Medicare for Part B until a later time for whatever reason, that individual enrolled in Part B, whether they're 70, 75, or older, they have an open enrollment period, and those policies at that time depends on how the state allow those policies to be priced. The individual, the policy at that time is going to be protected under Medicare policy, and protections. However, if you are outside of that open enrollment period, the longer you wait, insurance companies are less likely to sell you a policy, and if they do, tend to cost the individual much more to join a Medigap at a later time. But there's age limit.
Great, thank you. So we have another question, and I think this is an excellent one because sometimes people get confused about long-term care. And so someone asks, is a long-term care insurance policy completely separate from Medicare and Medigap plans, or is it a type of Medigap policy?
Long-term care policies are completely separate from health insurance, not just Medicare, Medigap, and Medicare Advantage. All private health insurance that exist out there are completely separate from long-term care policies. Care policies are designed to pay for services that are not health related in nature. So health insurance, of course, is going to pay for everything related to your condition. Long-care policies are basically to provide service and support that are not otherwise covered by your health insurance company, whether it's a private or it's a Medicare or Medigap policies.
Okay. We also have one ask if Medicare Advantage plans have to follow the same 2 midnight rule as original Medicare in order to go into SNF coverage.
No. Medicare Advantage plans don't follow the same rules, the same payment rules that Medicare has, with hospital deductibles and copayments, and that we actually reimburse hospitals based on benefits period. That is followed by the Medicare Advantage plan. They have a totally different way of reimbursing hospitals. And it's not based on 2 midnight rules or based on benefits period.
Okay, thank you. Let me see if we have any more questions. This is a good question. Are there instances when someone is enrolled in Medicare Part A and Part B but will not be eligible for a Medicare Advantage plan? And it would not be beneficial. David, answer that one.
So Medicare Advantage plan, although it may be a good option for a lot of people, it's not for everyone. So it is down to the individual healthcare need and budget on whether a Medicare Advantage plan may represent a better option for that individual. So we can't really say there is an advantage or disadvantage for a particular individual to go to a health plan, a private health plan under Medicare. So you do have to compare on your need and budget and see whether that option is better for you. And to say that Medicare Advantage plans are not available everywhere, and not all Medicare Advantage plan options are available everywhere too. So there may be many individuals that will be in their best interest to sign up for a Medicare Advantage plan.
Another example would be if someone has Part A and Part B and they have end-stage renal disease, they may not be able to enroll in a Medicare Advantage plan unless there's a particular special needs plan that's available for them to join. So do we have any other questions? You can go ahead and type them in. We'll take just a couple more, and then we'll wrap up and review our requirements for the post-training requirements and obtaining your certificate. Okay, I don't see anything else coming through, so I think that's going to conclude our question-answer session and our presentations for today, day 2 of our CEU live webinar training. Remember that you need to complete all of your post-training requirements. I'm going to pull up a pod right now on the screen that summarizes all of the steps you need to complete. For many of you, you also received this in a document. It was sent to you through email. You received an email. If you look in the Files Day 2 pod on the left side, you need the presentations from today that you can download, as well as the instructions document that gives you the step-by-step information that you need, exactly what you need to get your requirements completed and obtain your certificate. So I put on the screen for you. You also see our mailbox, training@cms.hhs.gov, and you can send any questions about the presentation to us there. If you have questions concerning the MS, our website, or obtaining your CEUs, you need to direct those to ntphelp@cms.hhs.gov, and we will make sure that we respond to you. With that, I'll go ahead and tell you that we'll stay in the webinar room just to respond to your questions. If you have anything you need to chat to us in the next few minutes, we'll be available in the room, but we're going to go ahead and conclude audio for today. Thank you, David, for joining us, presenting and answering questions. We really appreciate it. Thank you to Carrie and to as well, and to all of our team for providing technical assistance, Mark Rick and Joseph Warden. Thank you, everyone, and enjoy the rest of your day.